For my teaching presentation, my target population is the 9th grade health class, and I'm going to be presenting on Streptococcal Pharyngitis, or more commonly known as strep throat. By the end of this presentation, the students are expected to know background information on strep throat, as well as the methods of transmission, signs and symptoms, diagnosis, as well as treatment protocols, complications if the disease goes untreated, as well as prevention plans. I have created some performance indicators to assess how well each student comprehends the material that will be presented today. Each of these indicators will be implemented upon completion of the PowerPoint presentation. The first objective is for students to individually write down on a piece of paper at least 4 signs and symptoms of strep throat and turn that piece of paper into the teacher. The second objective requires students to work together in groups of 2 or 3 and fill out a worksheet listing at least 2 methods of prevention and at least 2 methods of transmission of strep throat. After completing both of these assigned exercises, students will take a quiz, and the intention is for each student to score at least 80% on the assigned quiz. We'll get started today's presentation with some background information on strep throat. It's important for me to point out that strep throat can be caused by either a virus or by a bacteria. Most commonly, it's caused by the Streptococcus pyogenes bacteria, which is also known as Group A Streptococcus or Group A strep. Strep throat is highly contagious and is most common in children ages 5 to 15 years old. Now, anybody is capable of getting strep, so don't think that once you turn 16 that you're no longer capable of getting strep. Strep is most common in late fall and early spring, and it's also extremely important to understand that people can be living with this bacteria, and it commonly lives in your nose and throat, but that does not mean that you will present signs of the illness. You are just a carrier, and you can actually infect others with the disease even though you do not feel any symptoms yourself. As I mentioned before, strep throat is highly contagious and can be transmitted through direct or indirect contact. I've listed some examples below, such as kissing, coughing, sneezing, sharing the same utensils, and drinking out of the same cup. It's really important to, especially if you know somebody has strep throat, just stay away from them, keep yourself clean, wash your hands. Strep throat is often spread among family members in schools or daycares, and a lot of that has to do with the close proximity of one infected person and others that are not infected. And also coming into contact with sores or even just cuts, anything from somebody who is infected with this bacteria. They may not be showing signs or symptoms of the illness, but if they're a carrier and they've got any sort of open wounds, if you come in contact with them, you may get strep throat. Alright guys, pay close attention to this slide, because if you remember before, I mentioned that after this presentation, you guys are going to have to hand in a piece of paper with at least 4 of these signs and symptoms. I'll go over them real quick. Sore throat, that's going to be the most obvious thing. You guys are going to have some trouble swallowing or pain when swallowing if you have strep throat. Strep throat often presents with a fever of at least 101 degrees. 101 to 104 is pretty average for strep throat. There's going to be some red and swollen tonsils, and there could even be these white patches. I'll show you guys some pictures on the next slide. Headache, nausea, vomiting, fatigue, body aches, and chills are also all very common signs and symptoms of strep throat. If you guys are experiencing these, or you know someone who experiences these, especially in this type of season, make sure they get to a doctor and get it checked out. It's definitely better to be safe than sorry. This picture on the left of the screen gives a real good depiction of an individual who's got strep throat. If you notice, they've got the swollen tonsils, they're red, they have those white patches that I mentioned before, and you can also see those red spots in the back of their throat. If you think you may have strep throat, it's really important to get this checked out by a doctor. The actual diagnosis process is pretty simple. The doctor has one of 2 tests they can do with you. One of them is a throat culture, where they're going to stick a swab in the back of your mouth to get some of the bacteria, and they then send that bacteria off to the lab for testing. The lab will then get the results back to you, and it is a very accurate test. However, the one downside is that this test takes a little time. It takes up to 2 days. A quicker test that you can do, or if lab testing is not available for you, is the rapid antigen test, where they then get another culture off your throat and they check in that bacteria if there are any signs of the Streptococcus bacteria. This is less accurate and can actually miss some of the cases of strep. Okay, so now you're at the point where you've been diagnosed with strep throat and you say, what do I do to get rid of it? In the case that you've got the bacterial infection, your treatment is going to be an antibiotic, and that's usually amoxicillin or penicillin. The antibiotic itself will attack the bacteria and essentially will fight this illness. However, you may still be experiencing some of these symptoms that have been previously mentioned, and you may also be prescribed something such as ibuprofen or Tylenol for some of the headaches and achiness. Now, the sore throat doesn't instantly go away, and depending on the person, you may want to try some of these things. You can drink warm liquids, cold liquids. You can suck on a popsicle, gargle warm salt water, or suck on hard candies or throat lozenges to try to help with some of these sore throat feelings. If you let strep throat go untreated, there can be some serious complications. The infection may spread from the initial site through the tonsils, sinuses, skin, blood, and even the middle ear. Some more serious diseases that can occur after an untreated strep throat can include scarlet fever, inflammation of the kidney, and rheumatic fever. Okay, now to end out this presentation, we've just got some prevention tips. Make sure you wash your hands. Do not underestimate the importance of hand washing, especially in a cold and flu season. Do not share food or drinks with other people because, as we previously mentioned, this disease is transmitted through indirect and direct contact. Make sure that if you've been diagnosed with strep throat, you take your full prescription of antibiotics. Even if you're feeling better, it is important to complete the entire prescription that the doctor has given you. And something that you may not necessarily think about is that it's important to replace your toothbrush, especially if you've already had the illness. That toothbrush is in your mouth, which is near the infection site, and if it's been in your mouth and the bacteria hasn't been in your mouth, what's to say that the bacteria is no longer on the toothbrush? So just keep that in mind, replace your toothbrush, and I'm going to end it with the most important thing, which is wash your hands. Now that the teaching presentation is over, this is the part of class where I would allot time for the students to complete those objectives mentioned earlier. Just a reminder, that's the signs and symptoms for the students to complete individually, turn in at least 4 on a piece of paper, and for the students to work in groups of 2 or 3 where they have to submit on a worksheet at least 2 methods of transmission of strep throat and at least 2 methods of prevention. However, due to time constraints, I'm only going to go over the quiz portion of the 3 learning objectives right now. At this time, the students will have 15 minutes to complete this multiple choice true-false quiz, and upon completion of the quiz, they are dismissed from class.